Hello everyone, Dr. Kainat here, and today we are going to talk about the pharmacokinetics. Pharmacokinetics study the events that happen to a drug from its administration to the time it is excreted from the body. It describes what the body does to the drug. Pharmacokinetics is one of the two major branches of pharmacology, the other being pharmacodynamics, which describe the effect of drug has on the body. The journey of the drug through the body involves four processes: absorption, distribution, metabolism, and excretion. Absorption is when we are going to administer the drug from the site of administration to the bloodstream, where distribution is the bloodstream to the body tissues. Metabolism is drug is chemically modified mainly in the liver. Excretion is the elimination of the drug from the body mainly in the urine. Metabolism and excretion are combinedly called as drug clearance. Pharmacokinetics of the drug depend on its properties as well as patient-related factors. For example, older patients or those with kidney or liver problems may have slower clearance rate, causing some drugs to stay longer in the blood. Knowledge of pharmacokinetics helps determine the optimal drug dosage for individual patient as well as most suitable formulation and route of administration for a specific therapeutic goal. Drug absorption varies depending on the route of administration, drug chemical properties, formulation, and patient factors. When a drug is given intravenously, it absorbs immediately, reaching maximum in the blood plasma almost instantaneously. This is not the case with the other routes of administration, in which the drug needs some time to get into the bloodstream and drug concentration in blood plasma increase gradually. The maximum or peak plasma concentration is reached when the drug absorption rate equal to the clearance rate. Peak time when peak concentration occur is an indicator of absorption rate. The faster the absorption, the sooner peak time. Oral administration is the most common route because of its convenience, but it may not be suitable for some drugs. Drugs given orally must survive the action of the stomach acid and digestive enzymes. Peptide drugs such as insulin, they are easily degraded in these conditions and cannot be given orally. Absorption of the oral drugs involve transport across membrane of epithelial cell in the digestive tract, primarily in the small intestine. Cell membrane is the barrier that all drugs must overcome to get into the bloodstream unless they are injected intravenously. Cell membrane consists mainly of lipids and therefore hydrophobic. They are permeable to small non-polar and uncharged polar molecules but non-permeable to large polar molecules and the charged particles. Most drugs are weak organic acid or bases. They alternate between unionized and ionized forms depending on the pH of the surrounding environment. The unionized form is usually lipid soluble and can diffuse across cell membrane, while the ionized form can't. A weak acid exists predominantly in the unionized form in the low pH of the stomach, so it absorbs readily through the gastric mucosa. A weak base, on the other hand, absorbs more easily in the small intestine where the pH is higher. Large polar molecules and ionized particles must use special channel or transports to move through the cell membrane. There are several ways this can achieve, but because these transportation facilities are meant for endogenous substances such as glucose and amino acids, only drugs that resemble these substances can hijack and use them. All drugs must be in solution to be absorbed. Drugs in the solid form must be dissolved. The rate of dissolution can be the limiting factor if the slower than the absorption. For example, sustained release forms are specifically designed to dissolve slowly, releasing small amount of the drug as it passes through the digestive tract. The goal is to produce steady level of plasma drug concentration to have a stable therapeutic effect with minimum toxicity. Chewing a sustained release tablet can release large amount of drug at once. A measure of the extent and the rate of absorption is bioavailability. Bioavailability is usually referred to as the fraction of the administered drug and is absorbed into the bloodstream and is therefore available to the target tissues. A drug immediately enters the systemic circulation and therefore has a bioavailability of 100%. An orally administered drug, on the other hand, must pass through the intestinal wall and is subject to eliminate by the liver before it can reach the systemic circulation. Bioavailability is usually calculated as the area under the curve, the plasma concentration versus the time curve AUC. Because the bioavailability of a drug is considered 100% when delivered intravenously, bioavailability of drug given other ways can be calculated by dividing its AUC by the AUC of the same drug given intravenously. Bioavailability of a defined drug from also depend on the patient factors. For example, bioavailability of the oral drug is low in the people with digestive problems or previous gastrointestinal surgeries. The use of nitroglycerin in the angina management is an example of how different route of administrations result in different bioavailability and therefore producing different therapeutic effects. Sublingual nitroglycerin diffuses immediately into the bloodstream, producing a fast, strong, but short-lived action and is typically used for immediate angina relief. On the other hand, oral nitroglycerin absorbs slowly, resulting in weaker but more sustained effect and is usually prescribed for preventive purpose.